My sweetheart. All right. You guys should let your aunt rest first before bombarding her with plenty talk. Wow, Bola, your kids are always vibrant. What's the secret, my dear? The secret is our family health plan from Avon HMO. Avon HMO? Yes, so since my husband bought the Avon HMO plan for our family, the burden of paying hospital bills and self-medication is completely removed from us. With their quick response and excellent service, we enjoy correct peace of mind. Sister. Well done, Mother of the year. I hear you.
Visit AvonHealthcare.com on your phone to buy your plan in just 3 easy steps. It's that fast and simple.
Avon HMO, empowering you to live healthier, fuller lives.
Smooth health on the drive.
It's a global observation that helps raise people's awareness.
Get health information and tips for optimal well-being.
How to prevent it, detect or treat it.
This is Smooth Health on the Drive.
Smooth Health on the Drive, in association with Avon HMO.
You're welcome inside Smooth Health. Sorry we started a bit late, but Lagos has its way of doing things to people that we really don't like. Yeah, you know, traffic out there is crazy, and today we have a good doctor in the house, and today we're going to be talking about endometriosis. Ladies and gentlemen, welcome inside a Smooth Drive. Our doctor, Dr. Edokpalo Osazua. You're welcome, sir.
You're welcome.
Hello. Good afternoon.
Good to have you in here. Sorry about the traffic, Jerry. If we had our way, we would have sent our helicopter to come get you, but unfortunately. Dr. Edokpalo is a consultant obstetrician and gynecologist with subspecialist in infertility and reproductive medicine, and he is presently a consultant with Avon Medical Practice. So today, a general discussion on endometriosis and other related gynecological conditions is what we're going to be talking about. Remember now, Lagos, Smooth Health is in association with Avon HMO, bringing you practical tips for healthy living every single day. Please do remember now, we will give you the contact for Avon HMO at the end of the show and how you can follow them or get them, or, you know, inquiries and stuff like that. Also, you can send us messages on the show today, 080-9444-0981, and we will have the doctor in here.
Give us details, generally.
Exactly. So, let's talk about endometriosis. First of all, am I getting it right?
You tried to some extent in your pronunciation.
Even your name, I tried.
You tried. You are doing very well.
I'm doing well. Thank you, sir.
Well. Yes. And when we talk about endometriosis, basically, when we say endometriosis was first described many years ago, as far as 1920, by one great scientist which called Samson.
Okay.
Another person also tried threw some more light on it, which was also called cooling. Basically, the endometriosis is defined as the presence of endometrial tissue outside the endometrial cavity. Basically, endometrial tissue is supposed to be inside the endometrial tissue, inside the endometrium. But when you now begin to see this tissue outside the endometrial cavity, we call it endometriosis. Sometimes we can also have some issues in where there is endometrial tissue basically inside the body of the uterus, which is called the myometrium. We refer to that one as adenomyosis. So basically, endometriosis, when we make a diagnosis of endometriosis, what we see basically are endometrial stroma, we see endometrial glands, and we also see what we call hemosiderin macrophages.
Oh, doctor,
that is just a lot.
There's a lot now.
I'm going to calm down.
We're very layman here, please. The focus is on the uterus, isn't it?
Yes.
This is where you're finding tissues that shouldn't be.
Yes. So the tissues are supposed to be in the uterus, but they are not there.
Okay.
But they are outside the uterus. When we say endometrium is the cavity of the uterus.
Okay.
So when those tissues are no longer there inside the endometrial cavity and they are now present outside anywhere, which can either be in the intestine, can be in the brain, can be in the thorax, can be in the ovary. So when we discuss it in detail and properly, it will become more clearer and clearer and clearer and clearer.
So how does it manifest? How do you know that
the patient has endometriosis? Basically, most of the time, it's difficult for us to establish whether patient has endometriosis diagnosis because there are other symptoms, other things that look like it. But however, if you see a woman or a young lady that comes that is within the reproductive age group, that will say reproductive, that's the age in which somebody can give birth to children. So that present with cyclical cyclical abdominal pain, for instance, which we refer to as dysmenorrhea. Like when we say cyclical, that means every cycle. When we say dysmenorrhia, that's a painful period. Okay? And we also have somebody that have pain when he's having sexual intercourse. Somebody having pain during sexual intercourse. For instance, what would also refer to as dyspareunia. And this person is trying to conceive and is not conceived. So what
You already defined.
So trying to conceive, but it's not conceiving. That's what we refer to as infertility. So they will not define that. We'll now look at it as, okay, most likely this patient is going to have endometriosis. So when we have those symptoms, but the thing can be so severe, as I said earlier, that the endometriosis can get to the brain. Some people can have seizures. Can get to the blood, that somebody can be passing out urine during menstrual period, can be passing out blood with urine during menstrual period, can get to the rectum. Patient can also be stooling blood during menstrual period. So when we have this kind of thing around, we'll say, okay, most likely this patient can have endometriosis.
So, someone once confided in me and told that, I'm not sure if I should be telling you, but I'm not telling the person's name. I'm not telling the person's name, but she said that she would often find blood in her navel or during her cycles. Is that part of it?
Absolutely right. The person is not wrong. The person is absolutely right. Because sometimes during surgical, when we talk about how a patient have endometriosis, can I say that we are not people that are having their own affair or what? But when we not discuss how a patient will have endometriosis, we will not discuss that one in detail. Because there's sometimes there can be blood in the navel because the tissue has got to that place, and when the patient is menstruating, the patient will have what we call bleeding navel. I've also managed a patient like that recently, and the patient is calling me to say thank you every day because I solved that problem.
So is it something that people do that makes them get have this condition, or is it just something that nature just unfortunately takes a wrong turn somewhere?
Okay, to some extent, that is. To some extent, there are some situations that you cannot really explain in life, but there are something that we do in life that will also determine what happens. For instance, there are some risk factors that people have said to be associated with it. Risk factor includes that some of you that take plenty of alcohol and caffeine. People have also said that there's a risk factor for it. Some of us that are just living that live a sedentary life, that don't do exercise, people have also say it's also associated with it.
Okay.
People that refuse to marry on time, decide to carry your marriage over. They at the same time, because you are exposing your endometrium to that will cause prolonged menstruation. You are not married, you are not getting pregnant, so automatically you are exposed to more of this endometrial tissue for a very long time. So these are also risk factors. But however, nobody actually knows what causes it. But there are some genetic theories that people have proposed that say that cause endometriosis. One of them is not a big name. It's coelomic metaplasia. Don't be carried away.
It is big, sir.
Yeah, it's not too big. It's coelomic metaplasia. When we say coelomic, that means there are some developmental things that form part of the body, like the peritoneum and comb. I won't say metaplasia, what we miss changes. Some of those tissue can undergo some degree of changes on their own, and they can become endometrial tissue.
What should a person look out for? Okay, because now, I mean, you've said a lot of things. So a person that probably is not feeling anything at the moment, what should he look out for?
Person that is not feeling anything at the moment, basically, that is why sometimes diagnosis is really very difficult. Until you start, as the patient comes around and you take a break, because there are other things that will look like it. If somebody is having painful menstruation, for instance, you think of it. Okay, especially when it's in the reproductive age group. If he's having, if he cannot get pregnant on time, you think of it. If somebody is having pain during sexual intercourse, you also think of it.
All right, tell you what we should do, Lagos. Don't forget, reach out to us on WhatsApp to be a part of our conversation. Let us know your thoughts on 0809-444-0981.
This is Primal, and you're listening to Smooth 98.1 World Class Station. Stay tuned.
Don't lose fever. If you lose fever.
Music is everything.
It was really a proud moment when my sister Sarah told me she was starting her makeup business. I really wanted to help her start off well. So when she said to me,
Brother Tunji, shake body now and support my ministry.
I answered, the support you need now is an Avon HMO health plan.
An Avon HMO health plan?
Yes, dear. I explained that because her health is very important. With an Avon HMO health plan, she won't have to self-medicate or spend money on hospital bills. Finally, I said, I'll subscribe for you online and pay for the first year. But from next year, you'll renew it by yourself.
Hey, thank you, Brother Me.
Visit AvonHealthcare.com on your phone to buy your plan in just 3 easy steps. It's that fast and simple.
Avon HMO, empowering you to live healthier, fuller lives.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Smooth Health on the Drive, in association with Avon HMO.
And Lagos, welcome back inside of Smooth Health here on Smooth 98.1. We still have Dr. Edokbolo in the building. And doctor, we were talking about endometriosis and the causes, how people's habits could actually cause it as well. You said something about drinking a bit too much or postponing marriage. Now, I have a very unique question that I'm sure people out there are also thinking about as well. And Lagos, don't worry, you don't have to type. I know it's on your minds. What about frequency? And I mean sexual frequency or lack of it, because what you said indicated that somehow a lack of it or a lack of the anatomy that makes babies would cause endometriosis. So would frequency, whether a lack of it or a bit too much of it, could that cause it as well?
No, at all. Frequency, because even people that have endometriosis tend to have some degree of scarring in their womb, and the womb tend to be plastered back to the part of the back of the tend to be plastered back, and because of that, they tend to have something that look like the ovaries are a bit enlarged because they contain some tissues that are there. So what we normally, most of those people that have endometriosis, they even don't have frequent sexual intercourse because it's usually very, very painful.
Okay.
So that is why sometimes some them actually cannot also get pregnant because when they cannot have frequent sexual intercourse, and because of that, they may not be able to meet their spouse when the woman is ovulating.
So you mentioned scarring. Could abortions also be something that could cause endometriosis?
Abortion basically sometimes when there's scarring, yes, to some extent, but depends. Most of the time, abortion will not cause endometriosis, it will cause more of what we call adenomyosis, because some of those endometrial tissue can be pushed into the myometrium, which is called the wall of the uterus. Okay. So when that one do occur, people can have adenomyosis rather than endometriosis. So we try to tell people that they should be very careful to when they procure an abortion. Okay. And now there are various ways of doing that. Is a story for another day.
Oh, yeah, that's a story for another day. Lagos, calm down. Let's talk about risk factors regarding endometriosis. The factors that would place you at a greater risk or lesser risk of having it.
Okay, basically risk factors. They are different types, but we cannot establish that is actually the cause. But the risk factor include one. For instance, for somebody that has started a period very early, that's what we refer to as early menarche. For those kind of patients, they tend to have endometriosis because the womb is exposed for a very long time.
Okay.
Secondly, for a patient too that also has what we call prolonged menopause, that is what we call prolonged menopause is what we call delayed menopause. Menopause is cessation of menstruation. So when we also have those kind of patients, they are also prone to having endometriosis. For example, they also have what we call a short cycle length. That is a cycle length that some people normally say, everybody normally say their period every 28 days, sometimes every 30 days. But some people have the one that is less than 28 days. So if you have that, there's a tendency that you can have endometriosis. Thirdly, for a patient too, they also have what we call increased menstrual period. That is, the period is very heavy. Okay, now they're also prone to having endometriosis. Now the theory that now explained that is what we call the transplantation, the migration theory, in which that those tissues they move away because they are being exposed for a long time, so they have to find their way out. They move to the ovaries, they move to the fallopian tube. And people that also have what we call narrowing of the lower uterine segment, like the neck of the womb, which is called the cervix. They can also have what we call endometriosis because the menstruation doesn't come out, so rather it goes up.
Okay.
People that have had D&C before, they also have stenosis. And people are also unlucky too, they also come with congenital abnormality that also cause it. Apart from that, there are also genetic risk factors too that also be associated with it. I.e., if your mother, not father here, because everything we're talking about is women.
Okay.
So if your mother has the tendency that most of the siblings will have it, there's a detailed explanation for that.
There's a tendency that most of the siblings will have it,
yes, because there's a genetic predisposition. The simple reason is that there's a lack of one material which is called HLA antigen. That is supposed to mop up the activities of all those things when they start growing, but those things are lacking. When that happens, the macrophages and everything will now begin to proliferate and the patient is prone to have it.
Is there a ratio though? Because, I mean, if you say that maybe the mother has it and then maybe the children, some of the children will have it, is there like a ratio to predict?
Percentage? Yes, there are percentage, but however, it has not really been established. But however, it's found that about 3 to 4% of patients that their mother has endometriosis, the children can also have.
That's a small number. That's a manageable number.
It's not manageable. If it's you, it's 100%.
Huh?
Yes. It's not a small.
Oh, you mean the person himself? Okay,
the person's
I guess
the person suffering from the ailment.
Yeah,
it's 100%.
it's not a
But you that is in the studio talking.
Okay.
Yes.
All right. What complications could arise from these from endometriosis?
Okay,
yes.
when we talk about complications that can arise from endometriosis, there are many. First of all, we have talked about inability to conceive. The woman that has endometriosis find it difficult to conceive. They have challenges with conception. Reasons I will explain if they come because we don't have a long time to talk about that. Secondly, the people with endometriosis sometimes they can also have painful during sexual intercourse. Now, when the thing becomes so worse, when it moves to all parts of the body, sometimes a patient with endometriosis can have what we call chronic pelvic pain. Everything, and she's coming to the hospital every day for pain control and other things. So those are some of the challenges. Sometimes the thing can be so serious that when it gets involve the intestine, the person can be stooling blood and it can have what we call intestinal obstruction. It can even get to the lungs. The patient can be coughing out blood. You thought that you have tuberculosis. It's not tuberculosis, it's endometriosis, because if it's cyclical, it can be so serious that it can even move to the brain and cause what we call catamenial seizure. That's a big name. It's just seizure convulsion. Because when you menstruate, the endometriosis increases, space occupied lesion, patient can convulse.
It's so grim, everything you've been talking about. It actually sounds pretty bad. So I'm waiting to get to the good part, which is treatment.
What can be done?
What can be done, because it's almost it sounds like a really bad situation.
It's not a little bad like that. At least the person is living doing well, but he's living with a lot of disability and it's not comfortable. Person is not comfortable. The treatment basically that we can do for them, we can classify them into what we call most of these patients are asymptomatic. When they do have symptoms, we treat. We can use what we call for the pain that they have. We can just give them non-steroidal anti-inflammatory drug. The basic reason rationale about this non-steroidal anti-inflammatory drug is that because prostaglandins have been found to be called prostaglandin that is found to be released that causes a lot of spasms. So when you reduce that with non-steroidal anti-inflammatory drug like ibuprofen, simple diclofenac, okay, Fedin, they can be used.
What are those drugs? What do they do?
They suppress pain. Anti-inflammatory. What say anti-inflammatory? They reduce the processes.
Okay.
Now don't forget that they do what we call prostaglandin, and prostaglandin have been found that to cause some degree of pain. But apart from that, the other drug we call hormonal treatment that we normally do. Okay. There are different types of hormonal treatment that are available. One, we can do what we call just the combined oral contraceptive pills, which we give to suppress menstruation. And there are things that you do when you are talking about endometriosis. That make the patient become like forced pregnancy, what we call pseudo-pregnancy, or make the person to become forced menopause, what we call pseudo-menopause. Or at the same time, you make them to not to ovulate, which we call anovulation. We never could have explained gender. Hopefully we have a lot.
There's no time. But I did hear you say something about contraceptive pills.
Yes, contraceptive pills. Yeah, contraceptive pills. That's where I was starting from. Combined oral contraceptive pills is okay. You can treat like the progestin only. You can use. Secondly, you can also use what we call hormonal drug like danazol, which have been found to be very useful. It's the testosterone that we use to treat it, but it has this whole side effect. Limited time, we will discuss that. Then thirdly, we can also talk about what we call gonadotropin releasing hormone, which is called.
Don't you call it again?
Gonadotropin releasing hormone, which is called.
In a layman's term, what is it called?
Yes.
Let's say I want to send someone to.
No, we can't do that. We can't do that.
We can't say because that's not me. They cannot. Nobody can do that.
They can't do that.
We can use Zolades for them. Zolades, called Zolades, marketed as Buserelin.
What about habits? Are there habits that people could adopt to help treat it? Like maybe, I don't know, don't do this or that. You already said too much drinking and all. But further from that, are there like simple things people who are already going through this condition can adopt as a lifestyle that could stop?
Yes, but
help
there are. But however, it has not been generally accepted. One, we'll talk about try to, as much as possible to reduce your caffeine consumption. Caffeine consumption. Try as much as possible to reduce alcohol consumption. Try to eat a lot of fibrous food. Try as much as possible to also do some degree of exercise. When you exercise well, there's a tendency that the symptoms can be relieved and you may not have endometriosis. But however, it's still a disease of controversy. There are a lot of things that are still coming out that we are still reading about every blessed day.
Wow, that's quite interesting. So with the hormonal therapy now, that would reference that it's a hormone thing. It would seem like it's hormones causing endometriosis. What exactly is hormone therapy? How does that work?
Hormone therapy basically that the one that will just combine with that contraceptive or the progestin only. What it does is that it causes the progesterone will cause the endometrial lining to thin off and destroy endometrial tissue. What we call decidual atrophy. So when that one do occur, there's a tendency that the patient will have a painful period. Because during that time, the problem that the patient definitely will not menstruate. So that's why I was talking about that. We call it forced pregnancy. So because the mom will have all the symptoms of pregnancy, but however, she will not menstruate.
Right.
The other one is danazol, which we are talking about, which is also used to. That will also cause some degree of prevent ovulation. And if there's no ovulation, there will not be menstruation. If there's no menstruation, there will not be pain.
Kayode here says, I wanted to ask a question, but I'm scared of what the answer might be. Kayode, go ahead and ask this question now. We'll also have the doctor in here. No, not this Kayode on
the other one,
Yeah. What about home therapies? If one is going through discomfort during endometriosis, one who has endometriosis, are there any things to do to make themselves comfortable?
Yes, if you have endometriosis and the pain is becoming very severe at home and you cannot control, what you need basically is to get those drugs available, like the non-steroidal antiplatelet, like the ibuprofen and the cataflux. So when the pain becomes very acute, you can take 1 or 2 tablets and you'll be fine before you see your doctor.
Okay. Alternative medicine, we always make it a point of note to ask about alternative medicine. Is there any that could suffice?
Basically, alternative medicine, I'm not really aware of any. The only thing I know about it is you can do what we call acupuncture. Acupuncture we found is a new research. The way you manipulate the back, and there can be some degree of relief.
Do we have support groups in Nigeria for endometriosis?
For now, I'm not aware of any.
Okay. Well, you should start one then, because you're so knowledgeable about this, so people can at least know that there's a community that attends to, things that they're going through and all. Well,
the reason behind that one actually, because many people actually doesn't know the diagnosis is already difficult to make. But now that there's increased awareness that there's endometriosis, people that have.
How much awareness do we have about it in Nigeria?
Our awareness is really very poor, because most of the time people that come that we even see in the clinic, we don't see them as endometriosis. We think of other things first, like pelvic inflammatory disease. We think of ovarian torsion first. We think of other things first that may cause. But when we now start looking for it and they will not examine them properly and we take a very detailed history, we will now be clear that rather than what they have is actually endometriosis, not pelvic inflammatory disease.
Wow. Well, thank you very much, Doctor. That was a very interesting expose there. Lagos, we've been talking about endometriosis here with Dr. Edokpolo Osazua, and he's given us some real good insight into what it is about in ways you can manage it. But please, if you have any such symptoms or anything the sort, my first guess, Doctor, I'm sure I'm right, would be to visit a doctor and make sure that you get yourself diagnosed properly. However, if you have further questions that you'd like to ask, you could also just simply call Avon HMO. The numbers are 090-224-71470. I'll do that again, 090-224-71470. Or you can follow them on Instagram, Twitter, and also Facebook. They are at Avon HMO. Or send an email to practicaltips@avonhealthcare.com. That's practicaltips@avonhealthcare.com. Lagos, thank you very much. Thank you very much, Doctor. Once again, we're looking forward to perhaps maybe having you back again to discuss something, anything actually. Yeah.
Interesting.
Well, thank you, Lagos. Do stay tuned. We are Smooth 98.1.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness of
Health information and tips for optimal well-being.
how to prevent it, detect or treat it.
Every Thursday at 5:15 p.m.
So Lagos, if you didn't know, now you know.
Smooth Health on the Drive, in association with Avon HMO.
It was really a proud moment when my sister Sarah told me she was starting her makeup business. I really wanted to help her start off well. So when she said to me,
Brother Tunji, shake body now and support my ministry.
I answered, the support you need now is an Avon HMO health plan.
An Avon HMO health plan?
Yes, dear. I explained that because her health is very important, with an Avon HMO health plan, she won't have to self-medicate or spend money on hospital bills. Finally, I said, I'll subscribe for you online and pay for the first year. But from next year, you'll renew it by yourself.
Hey, thank you, brother me.
Visit AvonHealthcare.com on your phone to buy your plan in just 3 easy steps. It's that fast and simple.
Avon HMO, empowering you.